And welcome back. The questions are still coming in about COVID-19, and we're continuing our live virtual conversation with Chad pediatrician Dr. Charles Capetta to answer your questions. And Dr. Keith asks, is there data that shows kids 12 and up actually need that booster shot?
My first reaction would be, like anyone else that gets the booster shot, to be fully vaccinated now is considered having that booster. So the pediatric data is still coming in, but for me, when in doubt, give the shot. That's all I would say here, and need it and need it and need it again. So we need that coverage, we need that protection, and that protection gives added coverage, particularly at home for elderly patients, grandparents, for immunocompromised patients, for their friends, neighbors, relatives. So I would say there is data. Personally and professionally, you need to have it.
Gary asks, with the rise in those breakthrough cases, does that mean that the vaccine actually isn't working?
Oh, not at all. Not any vaccine is not 100% effective in protecting you against what you're getting the shot for. So in the same case, and then that includes all our vaccines that hopefully all your children have gotten. But what I would say here, breakthrough cases are expected in the contents of how viruses work. So the breakthrough cases are hopefully milder and shorter lasting in duration, but it definitely does not mean the vaccine isn't working. It's working now because we're hopefully going to, in the future, see less cases. So please, 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 if you hear anything tonight, just go get vaccinated.
Okay, here's another question. How concerned should parents be when they hear about that very rare case of a heart inflammation as a side effect from the vaccine in kids?
As a father too of four, I'm very concerned about that. It's called multi-inflammatory system disease, similar to a syndrome called Kawasaki disease in kids, which causes fever and other joint pains and things like that. So it's rare, but when in doubt, again, seek help if your child continues to have a fever, looks lethargic, not breathing right, things like that. And I have in my professional practice have had one case already of that disease, and it's not something you want, but it's not, again, that's not a reason for not getting the vaccine. So my heart goes out to families that have experienced this, but please, please, please get the vaccine.
Doc, I have a personal question. I'm a new grandpa. I have a 2-year-old grandson just about now, and I'm wondering about the vaccine with him. Will it ever come? And should we be concerned at this point about trying to keep him away from crowds and groups and all that kind of stuff?
Oh, Tom, I share that concern. So I think congratulations, first and foremost. You're a great grandpa, I'm sure. Thank you for taking all the time tonight to do this. So again, I would predict that we're going to get to the state that we get the vaccine for COVID down to the 6 months and above. That would be my expectation. Now, that's a generalist speaking, not an infectious disease expert at all. But hopefully it becomes an annual shot that we can incorporate it into our normal pediatrics immunization schedule. And again, cautiously, I would say, as you think about where your body is and where your immune system is, be wary of people that have nonspecific symptoms of cold, runny nose, persistent fever, things like that. And we've talked a lot about bubbles in the past. Who's in your bubble? So in case of your family, Tom, who's in your bubble is key. And how you get into that bubble is determined by your own personal choice on what you want to do. But just be aware of that existence.
Good tips. We'll have more questions with our doctor coming up in just a minute. Stay with us.